All right. Well, welcome to another edition of Parent to Parent. I'm your host, Rashi, the parent, and we have Dr. Chang with me, and I'm going to bring him in just a second. But first, I wanted to talk to you guys about flu shots. I personally got my flu shot. I had both my kids get their flu shot. It was actually super easy because there was a flu clinic. And I know that many places do that now because there's such a huge amount of need, obviously, for the flu shots, the vaccines. And it was recommended by our pediatrician. So we got it. And my kids didn't feel, there's some soreness on the spot, but that was it. So we were, thank goodness, so far, so good. And then I read reports about how this flu season is supposed to be super bad. CDC came out with some stuff too. So I was going to show you what they said, specifically with they're seeing an early increase in flu cases with high to very high levels of activity, bunch of states, including here in Texas. So especially with, kids going back to school, obviously face-to-face interaction, and this virus does spread. So I wanted to bring in Dr. Michael Chang, who is with Texas. Here we go. UT Health Houston Children's Memorial Hermann Hospital. Thank you so much for joining us. This is such a huge topic because there's so many kiddos getting sick and the lines are so long at urgent care. It's like you're already feeling awful and you're trying to find answers. So let's talk about what you're seeing right now.
Sure. Well, first of all, I'll say it's nice to not be talking about SARS-CoV-2 for
right.
The last couple of days. So that's actually a good change. But unfortunately, it's about another respiratory virus, some old respiratory viruses actually that we would deal with every year before COVID. So the first thing that we are seeing actually is a big surge in respiratory syncytial virus, or RSV. And so this is another kind of childhood virus that we used to see every winter before COVID. And we would expect it to start usually after Halloween, around Thanksgiving. And we would have several weeks of a lot of cases of RSV, mostly affecting kids younger than 2, but really can affect adults and kids of all ages. And so we would expect that every winter, but then with all the infection prevention precautions and everything that we're doing with COVID, we actually didn't see much RSV for a couple of years until last summer. So summer of 2021, we saw a huge surge in RSV, which is really unusual time for that. And then that happened again this past summer in 2022. And we never really returned to baseline to that. And then, like you pointed out, kids are back in school, kids are back in daycare. Parents are really returning to work kind of as much as possible and kind of full force. And we're seeing RSV surge again in the last few weeks. And so that is bringing kids to the urgent cares and emergency rooms at a kind of time that you wouldn't typically expect it. And then on top of that, we're seeing the flu cases, as you mentioned, increasing too at the same time. So this is also an unusual time for flu. Flu is usually, several weeks from now, usually after we get that fall weather, which seems like that weather started today on Monday that we're talking. But, usually we think about flu and cold weather like after Thanksgiving. And our typical flu season here in Texas and the Houston area is usually, through Christmas to early March. And so the fact that we're already seeing high flu activity is probably 6 to 8 weeks earlier than we would expect. And so, that's very unusual too. And we're just seeing a lot of cases already. And so, unfortunately, it's at a time, like I was saying, it's been hot. You're not really thinking about flu. So even for people who had been or are thinking about getting vaccinated, it may not have occurred to them that they need to get vaccinated as soon as possible because it just didn't feel like fall or, and definitely like winter. But vaccine has been available. I have my own kids were vaccinated, myself. And so, and we all did fine. But yeah, with the flu cases increasing and kind of where we are already, definitely, we're seeing more people coming to urgent cares, emergency department, and we're really seeing more flu, like positive flu tests and positive RSV tests than any COVID tests.
Wow. So why the 6 to 8 weeks early? Why is that happening?
So that's actually not clear. Interestingly, this also was like this phenomenon of the cases starting sooner and the peak being earlier. This happened in Australia this past summer in their kind of flu season. And so their flu season also started early. And their peak was earlier than has been in the past. And we're not exactly sure. I mean, we think that probably what's been going on is, normally we have a flu season, everyone gets exposed. You may or may not have infection like symptoms, but everyone gets some exposure to flu. And so we think that kind of gives you a little bit of immunity every year, right?
Mm-hmm.
And it takes about a year or so for that to wear off. And so we expect these kind of like winter epidemics. But we've basically blunted that with all our infection prevention techniques. And so probably just a combination of flu started circulating, our behaviors have changed. Like you said, kids are back in school, and just all those kind of factors have come together so that we're seeing a flu season that's starting earlier than we would anticipate typically.
Okay. And so I've been reading about this strain, H3N2. Mm-hmm. So is this first of all, tell me what the strain is and if we're protected against it with the flu shot.
Sure. Great question. So every year, pre-COVID, everything changes with COVID, but even now post-COVID, typically what we expect is several strains of flu that circulate. And so there's a type of flu called flu A, and there's a type of flu known as flu B. And they're sort of related, but within flu A, there's usually two strains that circulate. One called H3N2, and then the other one's H1N1. H1N1 is actually the same strain that happened way back in 2009, the pandemic flu, and that's now stayed in our kind of population and remained the circulating H1N1 flu. H3N2, that virus, this particular type of virus, H3N2, has been around for several years, and it's the one that we would typically expect. But if the H part changes, like if it becomes like an H5 or H7 or something like that, that's when you might expect like a pandemic again or wherever. So, but within H3N2, you do get a little bit of what we call drifting every season to season. So even though last year we had an H3N2 and this year we have an H3N2, the H3N2s are a little bit different. And so ultimately, that's why we think, we have to get flu vaccines every year that are formulated again for, kind of that little bit of change from the flu virus. And so are we protected or not? It's a good question. You never can know for sure until the flu season's over, right? Like we can't know how well the vaccine performs until we've had a chance to see whether or not vaccinated people kind of got infected. But what we can do is we can look at the experience of the Southern Hemisphere, again, Australia's data. And what they found was that their flu vaccine, which has the same components as our flu vaccine, it covered at least 90%, like there was a 90% match in the strains of the flu A, the H3N2 and H1N1, and pretty good coverage for the flu B as well. And so, from that measure, we would expect that the vaccine is going to perform as good as it could. But it's important to keep in mind that, and I'm sure many of your kind of like audience will know, is that the flu vaccine is not one of our best performing vaccines, right? So traditionally, year after year, the flu vaccine has measured performance, like after the flu season's over and we're able to look at it, of like, 40 to 60% effectiveness, right? And some years it's even lower than that. And we talk about matching the flu strain with the flu vaccine a lot, or the flu vaccines to the flu strain a lot. But that's not necessarily a good predictor of exactly how well the vaccine will perform. So, unfortunately, we always have to wait till the end of the season to know exactly how well we're protected. But, even if you take kind of the lower end of, like, Australia's estimate this year for this past season will be 40 to 60% effectiveness. So even if you take the lower end of that, what that's measuring is that you have if you're vaccinated, you have a 40% reduction in the likelihood of having a flu illness severe enough that you need to seek medical attention. So it doesn't mean that it only works 40% of the time. What it means is that you have a reduction in risk of having more severe flu illness of 40% compared to somebody who's unvaccinated. So, to me, that's still, given the history of flu vaccine and the safety that we know of, like, I'm taking that 40% reduction in risk of having a medically attended flu illness.
Yeah, definitely. I mean, I know that that's one of the preventative ways. It's just so frustrating, and I get it, parents, and I'm sure, you do too. I guess, well, since you are a pediatrician, you can you have a little bit more knowledge, a lot more knowledge than the average parent. But, just going to urgent care and you're waiting, and it's like, what do I do? So what can you do? First off, if your child does have the flu? That was one of the questions. How can you treat the flu?
Yeah, so that's a great question. So fortunately, in most cases, the flu will resolve on its own for both adults and kids. The flu is different than the common cold, though, and you generally expect kind of more severe symptoms, meaning higher fever, probably more dehydration, more loss of appetite compared to just having the common cold, runny nose. But it can be definitely difficult to differentiate between a cold and the flu or RSV or even COVID for that matter, right? Like, all of these things can overlap. But for most parents, they'll just need to symptomatically treat their kids, right? So, like, fever reducers, making sure they stay hydrated. And that's going to get most parents through their child's flu infection. There are treatments available, but their effectiveness kind of depends on how quickly you can access them, the age range of your child, et cetera. And so I think most parents will get through their infections with supportive care, but in some cases, there are oral medications available, and you should then talk to your healthcare provider about whether that's appropriate or not for your situation. So some things that you want to look out for, though, certainly if your child has the flu, and like, when should you seek medical attention? For sure, if you have a younger child, if they're not eating as well, if they're toddler age and they're not having as many diapers as normal, if they're vomiting a lot and you're worried about their dehydration, then definitely seek medical attention. Also, if flu can cause a pneumonia, right, lower respiratory tract infection. And so if you start to see shortness of breath, worsening cough, difficulty kind of completing sentences, difficulty catching their breath while they're, bottle feeding or breastfeeding, if you see those types of symptoms, again, you should seek medical attention with a healthcare provider.
Okay. Yeah, definitely. Because I know that you just get so panicky when your child has a fever, but if you can try to treat those symptoms, I'm guessing at home, because when do you, because, like, say you have to wait in the waiting room 4 or 5 hours, like, do you recommend doing that just to see a doctor or maybe go back home? I mean, I know that, a lot of people don't have that kind of time.
Unfortunately, there's not a great answer to that, right? So ultimately, it depends on kind of what your situation is. Like, is your child able to keep liquids down, right?
Yeah.
Appropriate for their age? Are they having trouble breathing? Do they have underlying condition that makes them at higher risk for severe illness? Like, if you have a child with asthma, or if you have a toddler who has heart disease or a history of chronic lung disease, things like that. So, all those things are going to kind of factor into, like, how long can I wait in the urgent care waiting room, or how long can I wait in the line for the emergency department waiting room? And I think, unfortunately, I can't give you like a standard answer for that. But like I said, those are the main things. If you can't keep up with hydration, if you're having trouble breathing, then those are reasons that you would need to stay and that you would want to seek medical attention. But at the same time, if you have high fever, but you're able to manage that with fever reducers, and in between the fevers, your child's able to take some juice or some liquids that help hydrate them, and they're still having relatively normal amounts of wet diapers, or they're going to the bathroom okay, and they don't look like they're getting dehydrated, like dry lips, dry tongue, sunken eyes, that kind of stuff. If you're not worried about them being dehydrated and you're able to get the fever under control with kind of over-the-counter fever reducers, then I think you could wait, right? But again, just everybody's situation is going to be a little bit different.
Yeah, no, understandable. This question about how you can boost your immune system. What can you do now?
Yeah, so a common question that we get, right? So what are the things that you can do to boost your immune system? First of all is just being well rested, making sure you get plenty of sleep. Again, staying hydrated, physical activity will help boost your immune system, healthy diet, et cetera. Like all the things that you hear about that kind of keep you in good health, right?
Right.
Those are things that help boost your immune system. There's a lot of questions about things like zinc or vitamin C or echinacea. And I think, people have all different kinds of stories about that. For some people, they're like, it works amazing. And for other people, they say it doesn't really work that well. If you look at the medical literature, there's not really anything that says these things are going to boost your immune system, yes or no. And so I usually tell parents is like, if it works for you and you feel like it has a benefit, I'm not going to tell you no, but I'm also going to say, like, there's not really clear medical literature that says there's benefit. That said, using those things like vitamin C or echinacea or zinc, like you should still be looking out for those signs where you should go then see a healthcare provider, right? So even if you're a strong believer in vitamin C and you use it, if you do start to see dehydration, difficulty breathing, shortness of breath, like you still need to go see a healthcare provider at that point.
Got it. And so what about like multivitamins for kids? What do you think about those?
So, again, that's one of those situations where there's not really, like when you look at medical kind of evidence, there's not a clear indication or clear literature that says there's benefit. I think for parents that want to give it and that feel that there's benefit, I think there's relatively little harm in giving it. But again, there's not clear evidence that there's a benefit to overall health for multivitamins. I will kind of back up though, like if you do have a child who has asthma, or if you are an adult that has asthma, or if you're an adult that has underlying heart disease or other lung conditions, COPD, in order to kind of get your immune system and your body to the best state available so that if you do get infection, that you'll have the best outcome, you want to make sure all those things are under control, right? So if your child has asthma, you want to make sure they have their controller meds or rescue meds. You want to make sure their asthma is under good control. If you're an adult with heart disease, you want to make sure your blood pressure is under control, that you have your medications up to date, et cetera. And then there are other vaccinations too, even beyond the flu vaccine. Things like pneumococcal vaccine, which protects it against a certain type of bacterial pneumonia. If you're an adult that's older American adult, you want to make sure you're up to date on those vaccinations too. That can prevent you from having complications of having a flu infection.
Okay, awesome. Well, I wanted to end by showing this map because it's pretty crazy. This is from the CDC, and the influenza I think it was most recent from last week. So we here in Texas are on the higher levels. Do you, Dr. Chang, anticipate that this is, first of all, why do you think only like sporadically it's these states versus others?
Yeah, that's a great question. I couldn't tell you for sure, like why it is that we're seeing.
Why does the flu discriminate like that?
Yeah, if only I knew, I probably would have won the Nobel Prize in medicine.
Right.
But no, unfortunately, it's hard to say. Like I said, everything's been a little bit upside down, right? Like with COVID and kind of the last two flu seasons were so unusual, and so now this is a little bit unusual too. I think luckily, quote air quotes, like the flu will behave relatively like the flu. And so, if Australia had a season that had more cases than the last few years, or even considered a severe year, I think we will too. The timing's a little off. Why is it this particular distribution of states? It's difficult to know. A lot of it has to do with, again, social kind of like determinants, like behavior, how many kids are back in school, how many parents are back in the workforce, kind of our activities. I think what an interesting thing is as a quote unquote expert, we are often asked to make predictions about how things are going to go. And I think, and I have seen, for like COVID, for example, it's difficult to predict, right? Because we just we don't know. We're still learning about that particular virus. With flu, again, the seasons have been a little bit strange. And so, again, classically, we say, oh, once we go indoors and the weather gets cold, but it's been hot in Texas and people have been out, we've been doing our normal stuff.
Yes.
And so it's not exactly clear, right? So I think, what I think the important thing for parents and patients to keep in mind is, ultimately, we are trying to move with the data, right? Like you try to make recommendations and make decisions based on what you see in past experience, and you try to put all that together to try to give your best kind of effort and best recommendations. And so, I wish I could tell you exactly why Texas is high activity and other states around us aren't yet. But unfortunately, and I just don't have that answer. That said, what we do know is that getting vaccinated, can protect against severe illness, can protect against hospitalization. So that's still our best tool. So, no matter when flu happens, like the vaccine is still going to be kind of our best tool to prevent that severe illness. And, to kind of, I think you had alluded to earlier, like that way you can hopefully minimize days of work missed, days of school missed, stay healthy, avoid other unnecessary medical costs or additional medical costs that you were unanticipated. So again, regardless of when the flu happens, we do know that vaccine can help minimize the risk of severe illness.
Awesome. Well, Dr. Chang, thank you so much for your expertise. I know it's helped out a lot of people because, you kind of just try to figure out what is going on when my child or you yourself have the flu. You're not even thinking straight. So it's like, let's just prepare, ahead of time, get the vaccine, get your Tylenol and Motrin all ready to go ahead of time.
Sure. And if you don't mind, I just want to just emphasize one more time, like if you have underlying conditions, make sure you get those under control. Check in with your healthcare provider, make sure you've got those kind of lockdown under control, so that even if you do get infected, you're going to have the best chance of getting back to health as quickly as possible. And then one last thing, I just want to talk about RSV again. Again, that's circulating very widely, and the signs and symptoms for RSV, where you would want to take your child in to see a healthcare provider, are going to be the same ones we talked about, right? So if they're having trouble feeding, they're not having as many wet diapers as usual, if they're starting to develop shortness of breath, they can't complete their sentences, et cetera. So those kinds of, urgent signs and symptoms are going to be the same, whether it's RSV or flu or even COVID.
All right. Helpful information there. Thank you so much, Dr. Chang, for your time. I appreciate it.
Absolutely.
All right. Well, I hope that helped you all, and we will see you next Thursday for another edition of Parent to Parent.